Do you ever struggle feeling your muscles when you're doing certain hip exercises? Or do you have repetitive hip pain that you just can't seem to shake? Or maybe you're leaking urine even though you have a strong pelvic floor, coordinated pelvic floor, a mobile pelvic floor, and you've gone through rehab. What could be going on is you may be having issues with your deep hip core or your hip core because of the connection with your deep and outer core of your trunk. My name is Dr. Jocelyn Conley. I'm a pelvic floor physical therapist, founder of the Vagina Doc, and in this video I'm going to talk about the relationship between the core of the hip and the deep and outer core of the trunk. So let's talk first about what is the core of the hip. You have muscles that are more deep or deeper and that are more on the outside, but a core muscle of the hip are those that only cross one joint. So they really only move the hip joint or the pelvis if the hip's stable. And their job is overall precision of movement and stability, whereas what we call the primary movers of the hip are powerful and are responsible for the main action. So those would be a couple to name: hamstrings and the rectus femoris, one of the quad muscles. Now, core muscles of the hip would be iliopsoas, arguably a small adductor, a few small adductor muscles, the gluteus minimus, medius, and the deep hip rotators. Now, all of these muscles attach somewhere deep in the hip, which it could be on the outside, the back, or the inner portion of the bony femur, and then somewhere in the pelvis. Now, if we broke the pelvis down into components, it could be part of the ischium, it could be part of the sacrum, or the pubic rami. That doesn't really matter at this point. And because of those attachments, or one of those attachments, the iliopsoas, one of the portion of that muscle attaches directly to the spine. Now, why that matters is and how it relates to the deep core is because of these attachments. One major requirement for if you're working on your hip core is that one of those attachments, either the hip or the pelvis spine attachment, must remain stable. Otherwise, you don't get the full, unless, of course, the exercise is at full range of motion, but you won't work all of the muscle fibers. Or if you compensate, it could be working something a lot differently, or something can substitute. And how one of those attachments, let's just focus on the spine and the pelvis, remains stable is from the core of your trunk. Now, really quickly, your deep core, as a review, is a group of muscles: your pelvic floor, transversus abdominis, diaphragm, and multifidus group. Those muscles, their main role is to maintain optimal tensions and internal body pressures so that our spine remains safe, and the prime movers, or the other outer core muscles, can do their job really well, so the prime movers can do their job well. And then to manage pressures well enough so our physiological systems can work well. Our outer core are the other muscles that are our obliques, our trapezius muscles, all of those muscles that are close to the trunk that also promote just general core stability and trunk stability. So important here because when the deep core does not work well, the outer core can't work well because there's not enough good tensions for force to travel across our body diagonally and up and down, depending on what we're doing. So it really comes down to, if your deep core is not working well, then the outer core isn't working well. So all the attachments on the pelvis can be asymmetric, it could be just be off, so that when you are doing your hip core exercises, there isn't that for that other anchor point or the muscle to pull on. Why this is important is because a lot of, not only, because most of my followers and most of you guys are postpartum women and just women in general trying to overcome something related to your pelvic and abdominal health. I mean, is because postpartum or post-surgical, a lot of women are not getting rehab after major body changes during pregnancy and postpartum or a surgery. Maybe the surgery didn't change your body so much, but it changed the pressures because of the opening. And then either by the change in your body shape or just for protection from a surgery or trauma, it just stays offline. And the fibers are not restored to a level where they're functioning optimally. So what I see in the clinic is when people come in, they have apparently strong pelvic floors, coordinated pelvic floors, maybe overactive or too tight, or maybe part of the muscles are, part of them are not. They're obliques, but they're really struggling with breathing. They're really struggling with keeping their body stable during simple, slow movements because of that foundation wasn't brought back. So all the hip exercises that they're doing as well, I mean, they're not getting nearly as much as they would if they had a strong foundation. So in summary, for your deep core to work well, or for your deep hip core or your hip core to work well, you have to have a pretty good foundation of your trunk core, which relies on a strong foundation from the deep core. And arguably this also goes hand in hand. You have to have a good deep core of your hip to really maximize your core elsewhere. And if your core, of whether it's your hip or your trunk, is not working well, then your other big prime movers in your arms and your legs may not be, at some point you may plateau where you're not, like you're up and down and you can seem to get over the edge. Or you may be experiencing repetitive injuries. Say it's front of the shoulder pain, or back of the butt pain, front of the hip, lower back pain, neck pain. And why does this happen? Because areas of the joint are having more stress added to them because of the lack of precision from the deep core, trunk, and whatever joint, in this case we're talking the hip, is not it's not doing what it was designed to do to set your body up for success. So if this seems relevant for you, maybe and you didn't have rehab, or rehab was just kind of quick, or just, I mean, it's a proper rehab for postpartum is a pretty long journey. Proper rehab for a major surgery, C-section, or other abdominal procedure is it's extensive, and it's not just what you do in PT with a therapist, it's out as well. But maybe you need to revisit that and look at and encourage whoever you're working with a more holistic approach and more integrative approach. Or maybe that's your next step. You're in the beginning stages and that's where you go next. I hope this video was helpful. If it was, please press the like button. That helps with the YouTube algorithm. Also gets the word out about this information. If you know someone that could use this information, please share it with them. And then don't forget to subscribe and press that bell button so you're alerted every time a new video is launched. Thank you so much for watching, and I will see you on the next video.